As we prepare to vaccinate children throughout the U.S., here in Northwest Ohio, county health departments are already making plans. We have the Wood County Health Commissioner, Ben Robison, with us today. So how many doses did your health department pre-order?
For this first week, we have 600 doses on hand for pediatric recipients if they come to our vaccine clinics. And we know that there's plenty of vaccine available. So if we go through those completely this week, we can always order more to be ready for future weeks.
Now, what is the Wood County Health Department's plan for vaccinating children?
Well, it's really a multifaceted plan that involves all of our various partners that are here in the county. So parents can get their kids vaccinated at pharmacies that are participating. Their own doctors may be able to provide it in the pediatric offices. We have our hospital partners that are offering up vaccines, and then certainly the health department is too. We've published our calendar for the entire month of November, and we have some clinics that are starting to offer vaccines as early as tomorrow on Thursday. And then we have additional dates throughout the month that people can either sign up for in advance or walk into and get a vaccine on the day that they arrive.
Is the health department partnering with any schools within the county?
We do have a number of school-based clinics that were on the calendar even before this approval happened. So yes, if you're interested in getting vaccinated at any of those school clinics, we'll have pediatric doses there as well. And we're going to watch the demand. If it turns out that there is a lot more interest than there are appointments available, we're going to work to make additional appointments available through our health department and through our other partners too.
Do you have any personal take on that? Will you see, or do you anticipate a high number of people actually seeking out the vaccine for that 5 to 11 age group?
Well, we have had a number of calls already. I'm a parent actually of three people, three young girls who are between the ages of 5 and 11. So I'm going to be vaccinating my own kids tomorrow and watching to see what their experience is. And I think other parents like me are also going to be seeking out their doses. So we encourage people to go through their normal channels that they normally would get their vaccines. And I think you're going to find great success that way. And if it turns out that we have more demand than we can support, we're going to make sure that we step up our game so that we don't leave anybody wanting a vaccine and not being able to get one.
And finally, Ben, any personal goals here when you look at the number of children that fit into this 5 to 11 category? Do you have a vaccination rate that you would like to meet?
Well, certainly we hope that as many people take up the vaccine as there are available to get it. Here in Wood County, we have about 10,000 individuals who are between the ages of 5 and 11. And so we think that if they have a similar vaccine uptake to what we're seeing in the 12 to 19-year-olds, that we'll have about half of that population seek vaccine. That may not happen all in the first week, but we hope that over time people will go get their vaccine. And what we know is that when we look at vaccine rates compared, when we look at our vaccine and how it compares to disease outcomes, that individuals who are vaccinated have a lower risk of getting disease. And here in Wood County, for individuals 12 to 19 years old, this last week, the incidence rate was 10 times lower for people who are vaccinated. So there's a huge benefit to getting vaccinated. And not only do you prevent disease, but you also can have your kids still go to school if one of their household members has illness, whether that's COVID or something else, as long as they don't have symptoms once they're fully vaccinated.
All right. Well, thanks so much for being with us today, Ben. Of course, we will follow up with you as we see this vaccine rollout plan in the works.